Good evening, and thank you all for joining us for Congressman Bobby Scott's telephone town hall on the COVID-19 pandemic. My name is Austin, and I'm going to be your moderator for the evening. If you have a question you would like to ask, please hit *3 at any point during the call, and you will get added to the queue. Now, before we start the Q&A portion, I'm going to hand it over to Congressman Scott for some opening remarks.
Thank you, Austin, and good evening. This is Bobby Scott, and I'd like to thank you for joining this telephone town hall on the spread of the COVID-19, which is caused by the novel coronavirus. The last few weeks have upended many aspects of our daily lives, and many people are worried by their inability to pay their bills and put food on the table as we increasingly engage in social distancing so we can blunt the spread of the disease. Before I introduce the health experts joining us this evening, I wanted to briefly highlight some of the things Congress has done already to address the pandemic. And as a reminder, if you have a question, hit *3 to ask a question, and we'll get to questions in just a couple of minutes. Back on March 4th, Congress passed and President Trump signed the emergency $8.3 billion spending package to fund a robust response to the virus, mostly for vaccine development and support of federal agencies and local and state governments. Late Friday night, the House passed another bill, the Families First Coronavirus Response Act, which I was very pleased to see the Senate pass yesterday, and the President has signed the bill. The spread of COVID-19 will present increasingly severe challenges for students, workers, and families across the country, and this legislation will help ensure families are prepared for months ahead. The bill has essentially three elements. The first provides no cost for testing. All insurance companies and even the uninsured will have no copay or deductibles on getting a test. Now, I recognize that the tests are not generally available now, but when they are, people will be able to get tested with no copay, no deductible, and no cost. The second is maintaining access to nutrition, especially for children who are relying on lunches at their public schools, and they will lose that vital resource. In some cases, it's their only resource to nutritious food. There are more than 22 million children currently receive free or reduced price lunches, and 69,000 schools across the country are closed or scheduled to close, affecting about 35 million public school students. The bill provides that the schools can provide lunches not at the school, but in other ways like they do during the summer, so they don't have to invent the wheel. They can act just like they do during the summer, and they've waived a lot of rules and regulations to make that possible. There's another part of the bill creates a pandemic electronic benefit transfer program, or PEBT, that provides families an alternative access to emergency food, while the EBT program in cases of prolonged school closures. There's also a provision that simplifies the WIC program, Women, Infants, and Children Nutrition Program, that makes sure that they don't lose access to those benefits during the crisis. The third part of the bill was emergency paid sick leave that provides emergency paid sick leave to as many as 87 million workers. Regrettably, it exempted large employers, but 89% of them do provide already some sort of paid leave. Every employer that pays the 2 weeks, it's 80 hours of benefit. Every employer that provides a benefit under the bill will be fully reimbursed for the cost within 3 months for the cost providing the paid leave and maintaining the health insurance during that time. The bill will also benefit small businesses by helping them keep their workers healthy without taking on additional costs. Now, Governor Northam has also taken a number of steps to respond to the spread of the disease. He's ordered all K-12 schools in Virginia closed for at least 2 weeks. He's also issued an emergency order prohibiting more than 10 patrons at a time in restaurants, fitness centers, and theaters. The order gives state and local law enforcement the ability to enforce the ban, And additionally, he has urged all Virginians to avoid all non-essential gatherings of more than 10 people, and that is consistent with Center of Disease Control guidelines. State Corporation Commission has also issued an order directing all utilities it regulates, such as electric, gas, and water companies in Virginia, to suspend all service disconnections for 60 days to provide immediate relief for any customer, residential business, or business who may be financially impacted by the virus. Congress is now working on a third legislative package to respond. Negotiations are ongoing now. The package will be focused on further mitigating the economic impact of the pandemic through a direct economic stimulus, and I'm confident that we'll be able to come together to pass that legislation. Now, it is important that you listen on the health experts in reference to the health implications of the crisis, and I'm going to first call on Dr. Lauren James, who is the District Health Director for the Portsmouth Health Department. Dr. James, can you introduce yourself and briefly tell what you're working on during this crisis?
Hi, good afternoon, Congressman Scott. This is Dr. James, Director of the Portsmouth Health Department. As you mentioned, Governor Northam declared a state of emergency in Virginia, and since then, our governor, local politicians, city officials have been partnering closely with VDH to limit the spread of COVID-19. The latest recommendations include limiting numbers of public gatherings, recommended self-quarantine for adults older than 65 with chronic health conditions. These practices all support social distancing. By limiting group gatherings to smaller numbers, we decrease person-to-person transmission possibility, and by asking those older than 65 to self-quarantine, we hope to protect this high-risk population. It is important that people understand this practice of social distancing, although hard, is necessary to slow the spread. Locally, our health districts across our state are working diligently to support our healthcare providers and partners and community. We are providing guidance for testing when needed, along with case and contact surveillance locally. So that's a little bit about what we're doing, Congressman.
Well, thank you, Dr. James, and you'll be available for questions. Next, we have
Yes,
Dr.
sir.
Jordan. Thank you. Dr. Jordan Asher, who is the Chief Physician Executive at Centera Health Complexes. Dr. Asher, can you introduce yourself and let us know what you're working on?
Sure. As you mentioned, I'm Jordan Asher. I'm very honored to be included in this discussion tonight. The safety of our healthcare employees, physicians, patients, and definitely our communities is our top priority. For those of you who don't know, Centera Healthcare is the largest healthcare system in the Commonwealth of Virginia, and we are very proud to serve all its constituents. We have 12 hospitals across the state and in northeastern North Carolina, as well as a large medical and ambulatory group, senior services, and a health plan. We began our work on this back when the first case was diagnosed in the United States. Since that time, we've had a task force that was stood up, and more recently, we have started our System Incident Command Center. We are very focused on the following. First, the 3 T's: triage, test, and treat. How do we make sure that we get the right information to the right people to help them know and understand what is going on? How do we test, and I'm sure we'll talk about that more later, to see who might be sick? And then obviously, how do we treat? We think about that treatment with the 3 P's: people, places, and products or supplies. How do we have the right people who are appropriately protected to help those that are in need? How do we do it in places that are appropriate and making sure that we provide the utmost level of care? And how do we make sure that we always have the right products and supplies on hand? We also focus on the 3 C's: communication with the community, and more importantly, the community itself. As was mentioned earlier, it's very important how we think about the health of the community, not only when they are sick, but in other times and in preparation when things like this occur. And then, as we all know, continuous learning. We're learning about this every day, and therefore we are in a very rapid cycle of taking in all the information that is out there, all the great changes that are occurring at our governmental level, and how do we put that in our learnings to deliver the care that is needed? Thank you.
Well, thank you very much. And Dr. Asher will still be available for questions. Next, we have Dr. Brian Martin, who is Associate Dean and Master of Public Health at Eastern Virginia Medical School. Dr. Martin.
Good afternoon. Thank you for having me on your panel this evening and being able to address so many folks out there. At Eastern Virginia Medical School, of course, we're in the business of educating medical and health profession students. And right now we are more recently focusing on protecting the health and safety of our students, our faculty, and our staff, while also providing health care services through our clinical practices. In addition to that, and part of what I hope to be able to contribute to this evening is engaging in conversations to educate the public about their individual health related to COVID-19, but also the health of the community and the restrictions that we should be encouraging and participating in ourselves, as Dr. James mentioned. I'm sure we'll be speaking more about that later on this evening.
Well, thank you very much. And just a reminder, if you have a question, hit *3 and you'll be added to the queue. Final panelist will be my friend, Dr. Patricia King. She is a psychiatrist and also a member of the Chesapeake School Board. Dr. King.
Good evening, and thank you for having me. I am a medical doctor, and my specialty is mental health. As you know, this is a time of great vulnerability and change, neither of which is typically comfortable for most human beings. We are working to ensure that all patients who are in need of mental health services and substance abuse treatment have opportunities available to them. As you know, our children are out of school, out of their routines. Parents have been forced to make work and home accommodations, and many have been forced to stop working to care for their children. Many of us are faced with financial hardships, confinement, fear of our loved ones contracting the virus, and fear of ourselves actually being infected. This time of uncertainty makes the possibility of mental health conditions and substance use disorders certainly increase. So we are working hard to make sure that services are available to all of those who are in need, and we're working hard to help people learn how to manage their stress. And as you know, a healthy mind is a prerequisite for a healthy body. And once again, thanks again for having me.
Thank you. And again, if you have a question, hit *3 and you'll be added to the queue. And I apologize, there's going to be a technological challenge. It's pursuant to the Center for Disease Control. All of us are not in the same room, so I can't point to somebody to answer, so we do the best we can. Austin, you want to call on the first question?
Yes, thank you, Congressman. And like he said, if at any point during the call you have a question, hit *3. Now we're going to move to Clinton from Norfolk, Virginia. He has a question about people with pre-existing conditions. Clinton, you're on the phone with Congressman Scott.
Okay, yes. And my question is, I'm wondering if it's some kind of medical conditions that seem more vulnerable to cause a person to catch the virus, I guess. It's the best way I can put it.
Okay, Dr. Martin, you want to try that?
Sure, although I believe Dr. James or Dr. Asher would be in a better position, but just from the public health.
Dr. Asher, you want to try?
Sure, and thank you very much for asking that question. As we learn more about the virus, we are still learning there are two parts to your question. Number one, what makes you at a higher risk for catching it, and that seems to be just exposure. However, I do want to talk about those that are at higher risk for getting sick if they do become positive. And they really fall into categories of what we call chronic diseases. And for example, diabetes, heart disease, lung disease, whether it be emphysema or chronic bronchitis, and those who are immunocompromised, for instance, cancer patients that are undergoing treatment. The other areas that we have seen from the data are the elderly population seem to be more at risk for getting sicker. And that starts at about age 60 and continues to go up from there.
Thank you.
Thank you.
All right, thank you, Clinton. Next, I think we are going to move to Carrie in Chesapeake. She has a question about the homeless population. Carrie, you're on with Congressman Scott.
Yes, I was just wondering what Virginia is going to do about the homeless.
In terms of legislation, in the next go-round, there will be funding to address this. But Dr. James, did you want to comment?
Yes, so each locality, based on how they house their homeless population, so whether they have a shelter or different locations that shelter on a alternating basis, they are setting up plans and kind of touching base, because we also consider that a high-risk population. So each district is working locally to touch base and see what plans can be put in place to support that community. So, for example, if there's a shelter and they're concerned for a case, we would be in contact with them and letting them know that when they do seek medical care, to let that medical system know in advance that they're concerned for COVID specifically because of the contagiousness. But we are, putting in that framework, but it is a case-by-case basis since all of our districts are so different.
Great.
Thank you.
Now we are going to move to Lawrence S., who has a question about getting the virus and the chances for getting it again.
Dr. Asher, do you want to take that?
Sure. Thank you very much for that question. Lots of great questions. The question is about getting the virus and the chance of getting it again. As with other viruses, we learn something different with each one. From the standpoint, if you get it, right now it looks like you have some what we call immunity, at least for a little while, meaning that you really will likely not get it right back. However, we do not know how long that will last. And that is why it is so important as we're working on immunizations, because that is what we give to prevent you from getting it during a period of time. That's why it's so important when we talk about every year getting our flu shots, getting our immunizations, because that's what allows us to be immune to a virus if it comes up. So we're not quite sure how long one might have immunity, and we continue to learn that as more information becomes available.
Great. Next, I think we are going to move to Miss Felicia from Norfolk. She had a question about mobile healthcare providers. Felicia, you're on with Congressman Scott.
Okay. How you doing, Congressman? My question was, I'm a home health owner and assisted living owner, and right now I have heard that because a lot of people are out and the government's trying to keep everybody contained, so we'll probably have to stay in the house for 2 weeks. My concern is all of my patients, I have put them on quarantine because they are 65 and older, but if the government states that we have to be in the house for 2 weeks, are they going to make certain rules for home health workers? Because my patients have to be taken care of.
Dr. Martin, you want to respond to that?
Sure. The rules and regulations are just being looked at, as Congressman Scott mentioned earlier, even around schools, to see what's going to be necessary to take care of the crisis. And having people that are sheltering in place or being quarantined in place, even the recommendations now are not to leave home unless you have a medical appointment and to contact your healthcare provider prior to leaving for that appointment. So this is a fluid issue, and there have been a lot of relaxation of regulations for this particular crisis.
Great. Next, we are going to move to Ruth C. from Hampton. She has a question about the hospitals on the peninsula. Ruth, you are live with Congressman Scott.
Good evening, Congressman Scott. I was calling because I was very concerned when I saw that all of the test drive-throughs were being handled from either across over in Virginia Beach or Chesapeake or Williamsburg. We have 3 hospitals over here in this area, Santerra, Riverside, and Mary Immaculate, and there was no drive-through testing set up for this site. And with this being such a large minority population in this section of the city, I just wanted to make sure that we are not left out.
This is Dr. Ash. Yeah, this is Jordan. I am happy to answer that. And thank you so much for that. We continue as supplies, as we are able to expand our testing that many of you have, screening and testing that many of you have seen. And we are definitely planning in the planning stages to be able to come to your area. The early places that were most decided were where we were seeing a lot of positive events going on, which were a couple of those places you mentioned. Therefore, those were the first areas. We continue to expand as we get supplies and ability to do it in, and our definite plan is to be in all those areas.
Thank you.
All right, and everyone, you are on Congressman Scott's teletown hall on the COVID-19 pandemic. And reminder, if you would like to ask a question, please hit *3. Next, we are going to move to Marion from Hampton. She has a question about retired seniors.
Okay, we're retired.
Congressman Scott.
Thank you for this opportunity, Congressman Scott. We're retired seniors. Do we qualify for the stimulus that the president is talking about?
The stimulus has not been drafted yet. There are a lot of different ideas. There's a lot of different amounts. The idea is that everybody who is working will get some check up to a certain income level, and that hadn't been ascertained. Whether or not people on Social Security get an additional check, that is usually the case, but we don't know right now. I would like to see everyone, certainly under an income level, get a check so that we can stimulate the economy. One of the problems is when people lose their jobs, there's a cascading effect because they're not spending the money, and the people and the economy starts drooping. One of the ways we're dealing with this is the paid sick leave. So if people get sick, they still have income. We have liberalized the unemployment compensation so that people who lose their jobs will still get at least 2/3 of their check, and we're trying to move that up to 100%. There are a number of people who are left out in that, as you have suggested. If you're not working, you're not getting unemployment compensation. But we're looking at every different kind of way to make sure as many people get compensation under that plan as possible. But like I said, it's just an idea at this point. But hopefully we'll be able to pass something within the next week or so, and the ideas will get drafted into legislation, and hopefully we can pass it. But there's no firm legislation at this point.
Okay, because it seems like the products in the grocery stores, the prices have rose since the virus.
They shouldn't be raising prices, and there will be efforts to make price gouging a crime, so if they go up too much. I'm just advised that in the past few minutes that Senator McConnell, the majority leader of the Senate, has released legislative text. So we'll see what the Senate version is, and if the House doesn't like it, we can amend it and negotiate. But I can tell you there's not a lot of there's not a lot of interest in spending the next couple of weeks negotiating. We got to come to a decision and pass something so as many people as possible can get help.
All right, thank you. Next, I think we're going to move to an online question from Mrs. Warren. She was asking, will SOL testing be canceled for the students of Virginia?
Undoubtedly, there'll be flexibility with all of the requirements under the Elementary and Secondary Education Act and the state versions of that. We're dealing with it on a day-to-day basis. Obviously, schools will have trouble trying to educate students who are not in school. There are a lot of challenges, including particularly for special education students and students that do not have computers. There are a lot of people who this will be quite a challenge, and we're doing everything we can to make sure that as many as possible continue to get their education. But without students coming to school, it's going to be quite a challenge. But the idea that standards of learning, SOL requirements will be continued, I think you can assume that they'll be significantly relaxed.
Great. Now we are going to move to Stuart from Norfolk. He had a question about IDEA, actually. Stuart, you are on with Congressman Scott.
Good evening, Congressman Scott. It has come to my attention that in the Senate proposal for the next set of stimulus that Republican Senator Lamar Alexander is proposing to allow that Congress give authority to the Department of Education to at the request of states to waive requirements under the Individuals with Disabilities Education Act. It is fortuitous that you just mentioned special education, and we're concerned that they're taking this issue and bringing in something that's non sequitur to the stimulus as part of that. I don't know if you're aware of that, and if you have any comments.
I'm aware that there's an effort to relax requirements under IDEA and a number of other requirements. I would hope that we would not relax any of the requirements. We recognize it's going to be hard, but we have to try the best we can. If you waive the regulations, I think it's fair to say that special education students will not get an education. That's why we have the law to begin with. Now, even if from a technical point of view, even if the statute is relaxed, there's still obligations under common law. That's how this thing started about 40 years ago. People filed suit that special education students were not getting educated, and it was found that all students have a right to a free and appropriate education. So even if we relax the standards, the students would still have a legal right to an education. The problem, of course, is that under this emergency situation, by the time you've gone to court, you've missed too much. I'm going to do everything I can to maintain the requirements, recognizing that it's going to be hard to maintain the good standards that we've had, and just hope that we can just have people do the best they can. But the idea that we relax the standards, I think, would be very problematic, and I will not be supporting that. And hope it doesn't. Hope I'm not overruled on it, at least in the House.
Thank you very much.
Thank you very much. Next, I think we are going to move to Angelina from Norfolk. She had a good question that I think is on a lot of our minds about how we maintain our mental health when we catch cabin fever the next few weeks. Angelina, you're on with Congressman Scott.
Good evening, Congressman. Thank you for taking my comment. I am someone that lives with mental health and issues, and I was wondering if you had suggestions for people such as myself, so that we don't catch cabin fever and then our mental health gets worse.
We have a psychiatrist on the line, Dr. King.
Yes.
Yes, and thank you very much for that question. It is very difficult. The first thing is we certainly encourage you to be in close contact with your mental health providers. And we're making all kinds of accommodations in terms of virtual appointments, phone appointments to make your treatment accessible. We're also considering filling prescriptions for 90 days versus prescriptions that we typically fill for 30 days, just so that you have some security and, having your medication available. And then in terms of coping skills, the things that we know are helpful for healthy bodies and healthy minds, making sure that you get adequate amounts of rest, that you're eating healthy, that you're exercising. And although we're encouraging social distance, we're also encouraging you to stay connected by phone, by FaceTime, by email, because we know that social connections are really important, and isolation certainly can trigger worsening mental health symptoms. But in general, taking care of your health and making sure that you stay in contact with your mental health provider.
Okay. Thank you for that. I also had one more question included about the stimulus check, because personally I'm waiting for a court date on the 25th for disability. So I was just wondering, are people that were unemployed qualified, or it's still up in the air?
I haven't seen the legislative language, but one of the challenges is for people who have been long-term unemployed and do not have a recent employment history would not be eligible under the present law for unemployment compensation or paid family or medical leave. That is a category that we cannot ignore, because you have people who are long-term unemployed and now need employment, or a recent college student, college graduate, or a student that just got sent home from college will be looking for employment and will be out without any resources, probably will not be able to find a job. And so that is a category, people without a recent employment history, that is a category that we know needs special attention. But we will be looking at that. Like I said, apparently the Senate has come up with language. The House is working on language now, and hopefully that category will be covered.
Great. Next, I think we are going to move to Sydney from Chesapeake. Her daughter works in the ICU. Sydney from Chesapeake, you are on with Congressman Scott.
Yes. I'm in a high-risk group, but I'm especially worried about my family, and my daughter works in an ICU, and so she's probably at somewhat of a risk, because they say even some of the young people are getting it, and healthcare workers are especially, higher risk, because they're, even with precautions, they have exposure sometimes. I just heard that they may authorize the chloroquine, which is the antimalarial drug that they've used for years, as off-label. And I had been reading about this prior too, and it basically what was coming out of some of the countries that had success with it was that if it was used at a certain point in the disease process, that it had the best effect. And what I heard on TV tonight was that they were going to use it on the really severe cases, but that may be not. I mean, if the information based on, granted, it's not. This is not like the kind of clinicals that they would normally do the study, because this is, reports from doctors in other countries that have had success. But that's my question. Will they use it early in the disease? Will they wait till somebody's dying? I mean, it sounds to me like it would be better if with somebody who's high risk and who could go get worse, to use it sooner rather than later.
Dr. Asher?
Sure. First of all, thank you so much for all that you do, and especially what your daughter is doing. It is really great service to those in need when we put ourselves on the front line. And I know how you feel. So thank you very much.
My hats are off to all those healthcare workers. They're heroes in my book.
Yes, and so I do want to comment on treatments because that was one of the things I mentioned earlier. Both the FDA and the CDC have very much ramped up looking at the exact question you're asking, and using the information that is coming out of Europe, China, and Italy, along with lots of great universities such as EVMS here locally. To learn about that. There are lots of different trials going on. Just like the influenza, there is medication that is for prophylaxis or prevention, to your point, as well as treatment. And I do want to tell you that not only looking at for those that have severe illnesses from the virus, but also exactly what you're talking about. So we are monitoring that, and as soon as we are allowed to do that, and allowed meaning that we know it's going to work, these drugs do have other issues with them. That is exactly how it will be used from a health profession standpoint, as well as for the community as we learn more. But once again, I really want to thank you for the service of your daughter.
Well, thank you. I appreciate that, and I'll relay that to her. Thank you very much.
Let me add on another thing in terms of the ICU. We've been trying for about 10 years to get additional regulations under OSHA to protect health workers and others from being infected by communicable diseases. We haven't been successful, but I think this is the time when we really need the strict regulations to make sure the health workers are protected.
Great. Now we are going to move to Janet from Norfolk. She had a question about housing. Janet from Norfolk, you're on with Congressman Scott.
Hello. Thank you for taking my call, Congressman. My question is, my landlord has recently decided to raise my rent starting in May by 115%. What protections can be given to people in the rental community who have to choose between their economic safety versus staying at home and isolating, as this pandemic will be reaching its peak in the next couple of months?
If you're on a month-to-month tenancy where they can change your rent or that kind of thing, that is
it's yearly.
Say again?
It's a yearly contract.
It's a yearly contract. Are you in the middle of the year?
Yes,
so they can't change
it's due for renewal in May, but they wish to increase it at that time.
Well, we have provisions. There are a lot of suggestions on prohibiting evictions during the crisis. But if you call my office tomorrow, we can work on your specific situation. That's 757-380-1000. That's my office number.
Thank you, Congressman.
Thank you.
Thank you.
Okay.
All right, and you are all on the Congressman Bobby Scott Teletown Hall on the COVID-19 pandemic. And reminder, if you have a question you'd like to ask at any point, just hit *3. Next, I think we are going to move to Barry from Chesapeake, Virginia. Barry, you're on with Congressman Scott.
Yes, how you doing, Congressman Scott?
How are you?
All right. Now, you say that, well, the word is we're supposed to be self-quarantining and staying out of large social groups, but I want to know about these shipyards. Some shipyards are still working.
I'm aware that all of the shipyards are considering what to do under the circumstances. They're under contract to construct ships at a certain time. If they don't get it done, there are penalties for not getting it done on time. I think they're in contact with the Department of Defense to see what should be done under the circumstances. You're absolutely right. There are problems with that many people. You have to assume somebody's infected with the virus, and everybody is at risk when you have that many people. So I am aware that all of the shipyards are in consultation with the Department of Defense to see how they can work through this situation. But you're absolutely right. When you have that many people there, that's a problem.
Yes, because I know, like one of the yards, they gave out a paper today stating that if you had anybody in your household with heart disease, lung disease, high blood pressure, or any type of stuff like that, fill the paper out so you will be put on administrative leave. But it's a lot of people out there that they don't fall into that category.
I think all the shipyards recognize that they have a very difficult situation, and they're talking to the Department of Defense to see what the appropriate response should be. I would expect some of them to. I know some of them have workers on working from home if they can work from home, but obviously shipbuilding, you can't construct the ship from your house.
Right.
So we're gonna see. They're working on it now. We're aware that it's a problem, and we're gonna see what relief we can give. But we appreciate the call, and the Department of Defense should have an answer within a couple of days.
Okay, because you know it's a case of if somebody in Portsmouth has it now.
Say again?
Somebody, it was reported today that someone in Portsmouth has the coronavirus.
Well, that's not a surprise if you have that many people. And one of the problems we've got is that without the testing, we don't know who's got it. And there ought to be, at some point, the test will be available on a routine basis. Just like you go to the doctor, they take your blood pressure. They don't ask you, how are you feeling? You need your blood pressure taken. There ought to be just routine testing so we can get a clue as to how widespread it is. And I suspect that if you tested everybody, 1,000 people, somebody's going to be infected. And you don't know, without testing, you don't know who. And so it's hard. So that's why if it's right to close one school, you got to close them all because you just don't know where the prevalence is. And so it's been a real tragedy that we haven't been able to do testing. Like in South Korea, they're doing about 10,000 tests a day. We've done about 20 or 30, maybe 40,000 tests total. So we need to get the testing done so that we can have a clue as to where the problem is. But as I said, we need to get with the Department of Defense. They got to make some decisions. Dr. James, do you want to comment since you have a naval the Norfolk Naval Shipyard is in Portsmouth?
Yes, so Portsmouth did release a press release today that we did have our first case, lab confirmed case, private lab, I mean. So it was travel related. The patient had been to a travel 3 or travel 2 level area, but the caller does have some great points. And outside the shipyard, we are doing a lot of things across the city and locality to reduce staff at work. And I agree with the congressman that the shipyard most likely will try to do what they can to accommodate, but that is a concern that we all have shared. But we are, once again, trying to increase testing and along with the social distancing and other things we put in place.
Great. Next, we are going to move to Linda from Portsmouth. She has a question about differentiating between allergies, coronavirus, and the flu. Linda, you're on with Congressman Scott.
Yes, that is my exact question. Is before the coronavirus came around, everyone was concerned with the regular flu, and this being allergy season, how can you tell if you're having a mild case of the coronavirus or the regular flu or allergies?
One of our doctors?
Sure.
Yeah, this is Dr. James.
Go ahead.
Dr. James, I can take that one, and then everybody can chime in. So that's a very good question, Linda, especially with allergy season upon us, with the pollen on the cars. So we're really looking at a rule-out type situation. So if your symptoms are mild and you have no fever, trying things over the counter, such as antihistamines or nasal spray, if you're presenting with your normal allergy symptoms. But if you notice that this is something a little bit more severe and you're having things such as fever and difficulty breathing, then that's when you would want to be evaluated further by your healthcare provider to rule out the flu. And then the third line would be, if we've ruled out everything else that's common, then we'd be looking at COVID-19. So we do kind of look at higher risk factors, such as if you have comorbidities, if you're over 65, if you're immunosuppressed. But really, we want to rule out the common things first and then follow up on more specific things if you're at risk or had a contact.
If
right.
you
Thank you very
if
much.
You had
And then next, I think we are going to move to Steve P. from Norfolk. Steve, you're on with Congressman Scott.
Yeah, hello. This is Steve. Hello, Mr. Scott.
Hello.
Yes, hi. So I'm changing my question. What do you have a count for Norfolk on cases of?
Norfolk, I don't have the latest count. It's been going up exponentially every day. Dr. James, do you have the local numbers?
So BDH does have a website. I think it's BDH Virginia Coronavirus, and it does update daily, I think, at 5 p.m. But I last looked, sorry, I didn't check it today, but last looked yesterday, and Norfolk had 2 lab-confirmed cases. So if you want
2 cases yesterday?
Right, but if you want to check that site daily, you'll be able to follow it. So I would put in BDH Corona and then Virginia Department of Health, and those things will help you query it, and we can get the congressman that information too if he wants to post it to his site.
BDH.
That's a good idea. If you give us the website, we'll just we can tweet it out, and then we can just post it permanently on our website.
Okay.
Yes, sir.
Please do that.
All right.
All right. And the other question I had was, am I still on?
Yes, Steve, you're still on.
The other question was, what's going to happen to the people that are working for big corporations like Amazon? They're not going to get any sick benefits. Is that in the bill? What's going to happen to them? Are they just out of luck, or do the big companies have to do something?
Well, the exemption for businesses with more than 500 employees wasn't my idea, and it wasn't if you look at the original bill, it wasn't the position of the House. It was a last-minute negotiation, which I thought was just regrettable. But the fact is that about 89% of the businesses provide some sort of sick leave anyway. So if we had provided it, we would be essentially paying them for what they were doing anyway. And so there is a legitimate question about how well the money is being spent. That being said, we're going to try to get rid of that limitation and make sure everybody is covered in the next bill. That is a target that we're shooting at. And like as you know, Democrats in the House can pass it, but if the Republicans in the Republican Senate don't pass it or the president doesn't sign it, we haven't done anything. So we have to. We're not getting everything we want, but about 80-some million people did get coverage that they didn't have already. But the large companies. Now you mentioned Amazon. I think they have provided for coverage for their employees, and I think most of them we're hearing from are providing. And it's a good idea because if people are coming to work sick, they're going to infect the whole workforce. So you don't want them looking up, I got to make these last 2 weeks because I got rent to pay in 2 weeks. I need a paycheck. And they come to work, infect everybody. You like them to say, well, although I think I'm sick, I think I'll stay home and look after my health and the health of everybody I'm working with and just stay home like you're supposed to. It's much more likely if you're going to get paid leave. Now, the big companies could easily adjust to the fact that they have to pay the paid leave even if they didn't, because they're going to be reimbursed at 100% within the 3 weeks after they make the payment. But you're right to point out that that was a regrettable provision, and we're going to try to knock it out in the next go round. But most of the people are in fact already covered.
All right, thank you, Steve. And as a reminder to everyone, you are on Congressman Scott's telephone town hall about the COVID-19 pandemic. If you have a question, please hit *3. Next, we are going to move to Eddie from Newport News. Eddie, you're live with Congressman Scott.
Yeah, this is Eddie Harris, and I'm calling. I know you're working on the benefit package. I was wondering if you're considering allowing people to draw early on their 401k without the penalty.
Yes, that is a provision in most of the bills, and it's regrettable that people might have to access their retirement funds, but if they're in the situation where they have to, we certainly, under the circumstances, don't want to smack them with the 10% penalty for early withdrawal. So yes, that is a provision actively being considered.
Thank you.
All right. Next, I think we're going to move to Patricia from Hampton. Patricia, you had a question?
Good evening, sir. My question is for small businesses. Some of them are closing, they're staying open, but do not offer paid sick leave. What happens to my son if he gets sick?
If he gets sick and if he's unable to work, we're liberalizing the unemployment compensation, so hopefully he'll be able to take advantage of unemployment compensation. We're also trying to make unemployment compensation available to what are called independent contractors or small business people. If you can show that you've lost money, although you're technically not an employee, you ought to be able to get unemployment compensation. So we're working on that to make sure that anybody who's unable to work can get compensation. And the reason we're doing that is that if somebody loses their paycheck, there's a cascading problem occurring. They have food insecurity, they can't pay rent, so they have housing problems. I mean, the whole thing cascades into a bad situation. But if you can maintain the paycheck, you alleviate a lot of problems. And so for those that can't work, we're trying to use the unemployment compensation or the paid leave. Now, if they're under the bill that we passed, there's available for everybody 2 weeks of 80 hours, 40 hours a week, 2 weeks of paid sick leave if they get sick. The employer gets reimbursed 100% for that. And so that's the first order of business, and they're paid at 100% of their paycheck. So if he gets sick, the first go round is the first 2 weeks, 80 hours of paid leave that he would be entitled to, and hopefully we're going to be able to extend that. We pass the next package.
So this does concern the small business man, not just the large corporation.
If you're a small business, your employees will get the benefit of paid leave, and you have to pay it. Now there's a cash flow challenge. You got to pay the paycheck of somebody that's not working, but you will be reimbursed with a tax credit within a few weeks of having made the payment.
All right. Thank you very much.
Need to point out there is a caveat. Another last-minute amendment that was tossed in gives small businesses the option of denying the leave if the person taking the leave would compromise the viability of the business. If the business can't operate without the employee, the employer can deny paid sick leave. That probably is more a function of paid family leave, where you're staying at home to care for somebody rather than the person, because you don't want the person coming to work sick. so you might as well let them go. But there is a little loophole in there that was tossed in at the last minute that gives some small businesses the option of denying leave if the viability of the business is in jeopardy.
All right. Next, we are going to move to Gloria from Chesapeake. Gloria, you're on with Congressman Scott.
Yes, Congressman Scott, my question is on self-quarantine. If someone takes a walk and stays 6 feet from other people, are they putting themselves and others at risk by going out of the house and taking a walk?
Okay, you don't want a politician answering that question. You want a health professional. Somebody want to take that?
I'll take that one. This is Dr. King, and that's actually a really good question. As far as we know at this point, there's no contamination outside through the air, and we actually are encouraging people to try to get outside and go for a walk as long as you keep the appropriate and recommended distance. But we don't know of any contamination out in the open through the air.
Yes, and this is Dr. Asher, and that gets to a couple of questions earlier about mental health and being able to do that, as well as exercise, which is good to stay healthy, which then keeps you. And remembering self-quarantine doesn't mean you have it. It just means you might have been exposed or you've had certain symptoms that were mentioned earlier. And so we completely agree about getting in and getting out and getting exercise, remembering really trying to keep that social distancing 6 feet from others.
Great. Now we're going to move to Barbara from Hampton. Barbara, you are on with Congressman Scott.
Thank you, Congressman Scott. My question is, I am 55 and I'm disabled, and I have a son that's 14, and we both have underlying health issues. And my question is, are we included in the stimulus pack? Because I rent and I get disability, and I was wondering, was we included in the stimulus pack?
I think so, because checks will go out to just about everybody under a certain income level. It would be absurd if people who are disabled at home were excluded because they weren't working. They need that money as much as anybody else. So we hope that anybody. Now there are a couple of different variations. One was only adults would get money. I think it makes more sense for children to be counted in also. But we'll do everything we can to make sure that people in your situation actually get a benefit.
Thank you. Also, I have another question. Mike, I have a 21-year-old daughter, and she's a manager at a restaurant, Hardee's, and they have cut back her hours. She was working like 50 to 60 hours a week. Now she only working about like 25 hours a week, and she was telling me that the owner was saying that they wouldn't be able to apply for unemployment. Is it a reason why that they wouldn't be able to apply for unemployment, and she has rent that she has to pay too?
That's a good point. And I'm going to take that back. She's not eligible for unemployment because she's not unemployed. So I think the manager is absolutely the employer is absolutely right. But that is something that we're going to look into. She would be eligible for some of these if we send out a check. That she would be eligible for that, but let me make sure that we consider that situation where somebody is still technically employed but making a whole lot less than they usually do.
Okay.
Thank you, Barbara. Next, we are going to move to Jim from Newport News. Jim, you are on with Congressman Scott.
Thank you. Hi, Mr. Scott. This is Jim.
I apologize. I have a lung condition, and it's hard to understand me. I'll try to talk a little better when I can. I'm one of the high-risk people. I got lung damage from the fire department years that I loved every day, except my last one. And I'm on oxygen full time, and I have diabetes, and I don't have an immune system anymore, and dementia. I talked to my family doctor about the test, and he says because I'm not having active problems right now with the fever and stuff, because I have shortness of breath all the time, that I would be a candidate for the test. And I was just wondering if y'all had considered people that were extremely high risk, because I would think the sooner you would find out if it is a positive, the better it would be, instead of waiting until I started running fevers and getting sick from it.
Let me ask two questions about that. One, I asked some of the doctors if you are contagious without symptoms, and the second question, is there a treatment advantage in early detection?
So this is Jordan Asher. I'll try those, and if I forget one, please re-ask. First of all, yes, your doctor is correct. You are at higher risk. I would think about it as if you have changing symptoms, meaning if your shortness of breath gets worse, or you begin to run a fever, or your cough changes, that would be a change. Also, as I mentioned earlier, as we have the ability to increase our testing capacities, we definitely want to try to test those that are most vulnerable from a health perspective. From a contagious standpoint, it is spread by droplets. So if someone is contagious, it's usually when they cough or sneeze. There have been reports of people that had no symptoms, or at least they did not report having a cough or sneezing, and they were thought to be the possible source for someone else to get infected. However, the risk of infecting somebody else is much higher when you have a cough or you're spreading droplets from your mouth or your nose. I think the other question, Congressman, that you asked was about early treatment, which gets back to the comment that was made earlier, that as treatments become available, that would likely be much better than waiting to getting too sick. However, right now the treatments, even if you do have it, are symptomatic treatments, meaning taking medicine for the fever, taking other medicines, and making sure you stay well hydrated, drinking lots of fluids, which is always a good idea anyway, as long as you don't have heart failure. So those are the suggestions that I have.
Well, thank you. I do have one more, but I did want to make just a little comment on that. I'm in lung failure quite often.
Yeah.
And my children are really concerned, as they should be during this time. So I am self-quarantining myself here at my home. And
absolutely,
I know my children are bringing stuff here and dropping it off. And I hope all the young people out there are looking out for their neighbors, looking out for their elderly neighbors or siblings, and and not just thinking of themselves, but looking out for them, because really right now we need our youth right now to help out with the older crowd, because we're so much more susceptible and shouldn't be going out. But
could not agree with you more. Could not agree with you more.
Well, I'm one of them, and I'm pleading that you will. And I talk to the home health. I have home health that comes out quite often, And I called them today and spoke with the supervisor there, and I said, are y'all going to be bringing the test out for the coronavirus? And she said, no, they're not including, government's not including their RNs in this. And I said, well, they really should. It should be rethought, and they really should, because these RNs come out to some people that are not able to leave their home, and the RNs need the protective stuff, the mask and the gloves, and they're running out. They're running out of those supplies, because those nurses still have to come, because some of these treatments are life-saving treatments every week that we get in our homes. I just hope that's looked at a little closer. And my I'll be quiet a minute. Somebody wants to speak about that. Hello? Hello?
Yep.
Yes.
You're still on the line, Jim. Does anyone want to answer?
Jim, this is Brian Martin. I just wanted to tell you that I certainly appreciate the situation that you're in, and one of the things that you absolutely have to do, it sounds like you're doing it, is just take every precaution you can to protect yourself. And your kids are coming and dropping things off for you. That's great. Do not go out of your home unless you absolutely have to for medical reasons. Make sure that even when you're picking things up that are left for you on your porch, that you're going inside, you're washing your hands, thoroughly, at least 20 seconds with soap and water right away. Make sure that if you're interacting with anyone, that you're protecting yourself by wearing a mask if you have that available to you. And then, as was noted earlier by Dr. Asher, if your symptoms change, make sure that you're in contact with your healthcare provider so they can make sure that you get the proper treatment that you need.
All right. Thank you very much. Next, we are going to move to Carolyn from Norfolk. Carolyn, you have a question?
Yes, Congressman. Do we have enough PPEs, the personal protective equipment, for our healthcare providers here in Virginia? And what are we doing to make sure that we do? I just saw on the news where some parts of the country, they're actually trying to reuse things. What are we doing?
Dr. Asher, you want to say what's going on in Sotero?
Sure. That is a great question, and something that we are very, very focused on for the protection of those that are providing care to others, as well as the protection for the patients. We monitor that on a literally hourly basis. We continue to resource and source materials such as gowns, gloves, and masks from lots of different places all the time, and we continue to do things. Also, as you heard on the news, there are certain types of things such as eye protection that can be, it's not really reused, it can be washed down with bleach wipes and other things and alcohol wipes, so they can be continuously used, or as you put it, reused. We are not reusing anything that would jeopardize the safety of our workers nor of those that they serve. As this continues, one of the great things about the United States is that we do ramp up and we come together and we are able to accelerate to create the things that we need in times of crisis such as this. That will continue to occur, and I know Congressman Scott is working up in D.C. or hopefully by home to help with that part of what we are doing as well, which is really ramping up the manufacturing of additional supplies.
Great, and unfortunately this next question is going to have to be our last. We tried to get to as many as possible. There were a lot of great questions, but if you would like to stay on the line after the call has ended, you can leave a voice message. And for our final question, we're going to move to Deja T. from Virginia Beach. You're on with Congressman Scott.
Thank you so much, Congressman, for having this call today.
My question surrounds a small business. I live in the Hampton Roads area, and I manufacture a plant-based meat, and I distribute it at farmers markets, and I also do local delivery. So for me, I don't have any employees. So is there any type of local governmental stimulus package that's going to help us small businesses now that are affected by all these shutdowns?
Yes, all of the next package will have support for small businesses. I expect it mostly be in low or even no interest loans, which isn't as satisfactory as we'd like, but it's kind of hard to have a grant program for for-profit businesses. But the effect of this crisis on small businesses is certainly appreciated. The Small Business Committee was coming up with a list of recommendations to deal with the challenges that small businesses have. So they'll definitely be involved, but I can't say right now exactly how that will take place.
All righty, and that was our final question.
I want to thank everyone for participating. As Austin indicated, there'll be an opportunity to leave a message. And with the participation we had, it's obviously we're going to have to do this again pretty soon. The important thing, as you've noticed, I didn't try to answer questions, medical questions. It's important that you listen not to the politicians, but to professional healthcare experts on what you should be doing in certain situations. So again, I want to thank everyone for participating and look forward to the next call.